Hey, it's Biz, the hospitalist nurse practitioner. We just came off one of the craziest weeks ever in healthcare, and today we're going to talk about the Omicron variant. I'm going to give you an update from the trenches. I think this is such an important topic because in the news we're hearing about how this variant is less severe, but on the other hand, they're telling us how hospitals are full to the brim. So let's get into it. All right, let's talk about the differences between the Omicron variant and the Delta. So Omicron seems to be less severe, but I don't think we should get that confused with mild. It's definitely not mild for some. We do know that the Omicron variant replicates very well in the upper respiratory tract and the bronchi, but doesn't seem to replicate that well in the lower lungs. So what does that mean? So the good news is that we're not seeing as severe of a disease process because it isn't replicating in the lower lung fields. But the bad news is that there's lots of virus in the upper airways that we're breathing out, we're coughing, we're sneezing. So it is getting to more people. The other bad news is that because it replicates so quickly, it can invade both our vaccine and natural immunity. So those that are fully vaccinated and those who have had the virus before can get COVID again. The basics of Omicron. We do know that it is highly contagious, so ditch the cloth mask, ditch the gaiters, stick with a 3-ply surgical mask or a KN95 or N95. There's lots of good resources out there to help you pick the right one for you. Common symptoms of the Omicron mimic that of the cold and flu. So you see the runny nose, the sneezing, the headaches. I will tell you I've had several people think that they've had ongoing migraines, but actually turned out to be Omicron. Fatigue, and a new finding is night sweats. Night sweats would be when you're sleeping and you wake up just soaked all the way through your clothes. So early evidence indicates that it is less common for those infected with the Omicron variant to experience severe disease and end up in the hospital. But hear me out. All right, so we have two pictures here. On the left side, they're going to represent the Delta variant, and on the right side, it's going to represent the Omicron variant. And we're going to use the theory that Omicron is twice as contagious, but half as lethal. So on the left, Delta, one person's going to give it to 3, and then you see those 3 each give it to 3. On the right side, you see one person give it to 6, and those 6 then are giving it to 6 different individuals. Now I know, math is hard, so I ran the numbers for us. So on the left side, the Delta variant, if each one of those stick figures represents 100 patients, that's 1,300 infected humans. So if we have 1,300 people infected with a 4% hospitalization rate, that equals 52 people getting hospitalized. On the right side, we have the Omicron variant. That's 4,300 infected with a 2% or half the amount hospitalization rate. That's 86 people hospitalized. So even though Omicron is less severe, the numbers, because it spreads so much, still puts an impact on the hospital system. So let's get into some interesting statistics out this week. COVID hospitalization rates in the U.S. have risen 82% over the last 2 weeks. With that being said, 17% of U.S. hospitals are reporting that they're critically understaffed. 1 in 5, guys, that's a lot. For my East Coast peeps, it's important to know that DC saw a 221% increase in hospitalizations over the last 14 days. Virginia, 102%, Maryland, 97%, Pennsylvania, 45%, and for my West Virginia folks in the holler, 35%. So moving forward, what does this mean for us? Well, I think the next few weeks are going to be brutal in healthcare. I think that we probably experienced the worst last week, but I don't want to jinx ourselves. So we know historically that hospitals fill up this time of year because we have influenza, we have pneumonia, and now it's going to be a lot worse because this is all happening plus the COVID. I also think that this could end up being an endemic virus. Endemic meaning that it's never going to go away. But don't let that scare you because we already have 4 coronaviruses that float around all the time. We get that virus all the time. It doesn't even make us think twice. I think this could potentially be the 5th coronavirus, an annual cold that we may experience. So we have a lot of personal choices to be making. Do I want to avoid crowds? Do I want to limit my exposure? Do I want to be vaccinated and prevent severe disease? Do I want to continue masking and once again limit exposure? And do I want to get tested if I have symptoms to possibly prevent the spread of the disease further? I think it's all about staying positive. The one thing that we do know is that we have the tools that we need. So supply chain issues are becoming smaller and smaller. You can vaccinate yourself and get a booster if you feel that's beneficial. It's the same concept as the influenza vaccine for the healthcare community. You can decide, right? Do you want to get vaccinated or not? You can also purchase a KN95 or an N95 high filter mask. There's new oral medications out on the market. That's something you can discuss with your personal doctor. And also the home rapid antigen kits are getting more and more available. And the accuracy is pretty decent. It's usually about 96 to 97% if you're symptomatic. I think one tip to take away with the test kits is making sure that it's authorized by the FDA. In the end, my healthcare worker friends, hang in there. If you're not in healthcare and you know someone that is, reach out to them just to see how they're doing. We're all taking a big hit mentally. It'd be good to hear just a few words of kindness and spread kindness. I think there is light at the end of the tunnel. I think we're going to see less and less mandates because it doesn't matter if you're vaccinated, boosted, we're still going to carry the virus and spread it. And another good thing in the end is that there's more clear treatment options in the future. Coming out, both Pfizer and Merck have released oral antivirals for those with mild to moderate symptoms. Merck came out with molnupiravir, and then Pfizer came out with Paxlovid. All right, friends, that's all I have for this week. I'll be back next week with another fun topic. Thank you so much for watching, and if you could please subscribe. Thank you.